Welcome back to the Mental Space Live, and we are here live at the 5th Integrated Abu Dhabi Mental Health Conference with many inspiring speakers, none more so than my guest right now on the podcast. Please welcome His Excellency Maqsoud Kruse, who is the Chairperson of the National Human Rights Institution here in the UAE. It's a genuine pleasure to have you on the podcast today.
The pleasure is always mine, Scott, and thank you for giving me my first opportunity to be on a podcast.
We're deeply honored to be able to give you that.
Thank you.
We were talking on stage this morning, and I was really struck by the conversation that we were having.
Yes.
And we talked about the fact that, 2 years ago, the theme of World Mental Health Day was that mental health is a universal human right.
Correct.
I wanted to ask you, because we have a bit of a tradition on the podcast,
Yes.
which is, what does mental health mean to you? What does it look like in your life?
This is an excellent question and a good start, because I can tell you it goes as back and as long as I can remember. First of all, I fell in love with psychology when I was 13 years old.
13 years old.
13 years old. And it was the early writings and readings when it came to Sigmund Freud, psychoanalysis, what it all actually means. For me, I've always been inspired by the sponge between our ears, what makes us tick, why we do what we do, why we don't do what we don't do, and what does it all really mean at the core to be a human. Then gradually I started reading a lot about clinical psychology, but then neuropsychology, physiological psychology, and I was just immersed in that world. And I made a decision at that time that I wanted to be a psychologist when I grow up. And that's exactly what I did. So even at school, my choices were always choosing subjects of psychology. And later on, when I joined the United Arab Emirates University Bachelor of Psychology, this is what I exactly did. I still remember my first internship back in the summer of 1997 when I did my first clinical training at the what's so called at the time New Psychiatric Hospital. Now it's called Behavioral Sciences Pavilion as part of Sheikh Khalifa Medical City. And I remember I was part of Team A. That team was led by the director and the founder at the time, Dr. Zain Abbas Omara, an established psychiatrist. And he also taught me at UAEU physiological psychology at the time. And that was my first experience, meeting the different patients, dealing with the different topics, attending different clinical rounds, performing psychometric tests, performing psychological assessment. But then later on, with my different career choices, I ended up doing my master's in organizational psychology at the University of Melbourne in Australia. And that in itself was a unique experience because I also interned in something quite different, not too clinical, but focusing on conflict resolution, peace psychology. And that led me to be also interested in other areas where psychology continued to be a theme. Therefore, for me, understanding mental health and what does it actually mean has been always part of my interest. Seeing people in pain and trying to figure out why they feel the way they do and what can we do. And we go into all kinds of debates. Are they patients or people? Should we go with a medical model? So I see the symptom. If I treat that, there's no disease. Or actually, we're talking about something more complex, more structured. What's the role of psychology in this? What's the role of cognition? What's the role of emotions? What about the behavioral component? What about the social component? And that discussion and debate still continues.
The concept of mental health being a basic human right.
Yes.
I imagine with your role, that deeply resonates with you.
Absolutely.
But tell me why and how you feel that so deeply.
Absolutely. When I was given the opportunity to serve as the chairperson of the National Human Rights Institution, which is a young institution, we're only 3 years old, and it started through the enactment of Federal Law number 12, year 2021. And as we went through the different blocks of establishment, building the organization from scratch and going through the different steps, at some point we performed what we call more of an organizational retreat, trying to strategize as a team, as a group, where we're thinking, what are our priorities when it comes to human rights? So we came with 4 strategic directives that actually dictate and constitute what we're planning to do over the next few years. Number 1 is the right of workers and how we can support them.
Yes.
Number 2 is the right of women and children.
Yeah.
The right of people of determination. And number 4, which was unique within our context, is the right to health and right to mental health.
Yeah.
And the inspiration for this was that in 2023, as you rightly mentioned, while the world was celebrating the slogan that human right is actually part of mental health, and therefore everything related to mental health has to be a fundamental human right.
Yeah.
The United Arab Emirates produced, in fact, a piece of legislation related to regulating mental health in the late of 2023, and that law took action in May 2024. So for us, that was an inspiring moment, thinking, what are the rights of the beneficiaries of mental health services? What are the different issues related to that? How about equality and having equal access? What about issues of privacy, confidentiality? What about stigma and what these kind of issues relate when it comes to the component of human rights in mental health?
I mean, we have this campaign called Tear Away the Silence. Mentl was born basically to tackle the stigma of mental health.
Right.
How important is it for that awareness raising piece, for that ability for people to be open and honest? Because we've sat on stage this morning,
right,
in this fabulous conference,
absolutely,
with so many people in a huge amphitheater,
yes,
hearing powerful story after powerful story of individuals who've bravely shared their stories. How important is that tearing away the silence? How important is it for us to be able to talk about mental health in the same way that we would talk about physical health?
It's significantly important, Scott. I'm privileged and honored to be co-moderator of that brilliant session of the Silent Heroes.
Yes.
6 individuals, 6 journeys, 6 different stories that touched our hearts, but also exemplified that no matter how difficult the situation might be or our mental health, at the end of the day, the decision to continue to move on, asking for help, the support you get from the community, and the fact that His Highness Sheikh Mohammed bin Zayed, our president, announced that the year of 2025 being the year of community, there's nothing more significant than connecting the dots, because a thriving community is based on thriving individuals. And there's a big role for mental health to support the community and build on that. The main takeaway, frankly, is that at the end of the day, sharing these stories amongst clinicians, academics, policymakers, strategists, is to emphasize that at the end of the day, all mental health services should always keep in mind that there's a story behind every service. Every pain, every suffering, there's hope, there's resilience, and there's something wonderful that emerges. And we've seen some of the heroes are actually fantastic musicians. Some are actually fantastic artists. They were able to transform and transcend to become something more than just their condition.
You talked about the new piece of legislation, the UAE Mental Health Law. And as a mental health advocate, for me, that felt like such an important, such a massive step forward. And from your perspective, what does that signal to the community that the leadership of this country is in black and white saying mental health is important, it is enshrined in law? How important is that for you?
It is so important that the leadership is clearly stating mental health is a priority. It's at the heart and the core of their vision and their view of the future of the United Arab Emirates. Both citizens and residents, everyone who's a member of this great, promising nation will realize that being healthier, both physically and mentally, will only mean flourishment and means enhancement. And the way we are operating within the UAE is always based on the ability to make a difference, to achieve excellence. And we are looking forward to achieving excellence within the mental health sector, but also advancing mental health systems, services, policies, and looking at also the role of technologies and how we can incorporate that. At the end of the day, being positive in our approaches and focusing always on what we can do and what we can achieve is very, very important indeed.
We talked this morning about collaboration.
Correct.
And that crossover between the public and private sector.
Yes.
To me, as an outside observer, it feels very much like the public sector, the government, is leading the way.
Yes.
Having worked in the workplace, sometimes it feels like the workplace, the private sector, has a little bit of work to do to catch up. What's the call to action to the private sector? When we look at the direction of travel here in the UAE, it seems to be more thriving, more well-being, but more ambition to succeed even more. So what would that call to action be to the private sector to join the government in its mission?
Absolutely. First of all, this is a global matter that we all need to pay attention to. So we have different strategies issued by the World Health Organization, by different United Nations bodies, focusing on the right to mental health, not just within the regular social day-to-day activity, but also promoting mental health in the workplace and what it means to create positive environments, productive environments, that the teamwork, the positivity, the spirit that comes through the team, and how leadership can move forward on that. For example, Scott, during the COVID, we realized something. We used to talk about chief executive officers.
Yeah.
That's the classical executive approach to leadership. But then, because of the challenges associated with the COVID, especially related to mental health, a new type of leadership emerged, chief empathy officers, where they can see through these screens where we had our online meetings and connect and bond with their own team members, realizing and addressing the challenges, the difficulties from working remotely, being deprived from your social interaction and your day-to-day routine. However, that concept of chief empathy officers is what we continue to need and to have, where the corporate side of things will start to realize if you want to have profit, you need production. And if you want to have production, you need productivity. And if you need productivity, you need motivation. And if you need motivation, you need to have well-being. And therefore, mental health is also about mental well-being. It's about mental resilience, psychological immunity to be able to address the daily challenges. But not only that, Scott. If I'm feeling well, feeling positive, feeling that I'm contributing, then I'll be unlocking my potential.
Yeah.
What about the promises that we can make in terms of finding talent, cultivating gifted people, helping them to achieve their potential and self-actualize, given that everything that we do at work in many ways defines who we are, let alone that there are a lot of numbers when it comes to the prevalence of mental health issues within the workplace, sometimes because I have a problem with my colleagues or the working environment is so toxic, people lose their grip and they feel they're being attacked, they're being limited, and they lose interest and passion. And the moment you lose that, you lose everything.
We often say it's good business to be a good business.
True.
You know, I mean, the UAE has long shown that bringing people with you
Right.
is far better than dragging people.
Absolutely. Absolutely.
What gives you hope? Tell me about, we talked about the direction of travel. You've been very generous with your time. I know you're very busy. What gives you hope? And tell us about the direction of travel from here. I mean, again, this conference has just grown year on year. The messages that were coming on the floor this morning were just so inspiring. So we feel like this is a journey, but it's not job done, is it? We build from here onwards.
Absolutely. The true source of inspiration, Scott, is the difference I witness every single moment I engage with our wonderful heroes, champions of mental health. Listening to their struggles and seeing their triumph, not by having 100% condition free, but being able to continue to pursue who they really are despite of their condition, to continue to be functional within their families, with their societies. Self-regulating is very important, and therefore they always remind us the decision to be mentally healthy and sound and positive, it's actually sometimes a matter of choice, a decision to seek help, to ask for consultation, to look for advice, and sometimes you become the change that you're calling for. And frankly, there's nothing more powerful than understanding that there's more that we can do, and life at the end of the day, Scott, is what you want it to be.
That very much feels like a mic drop moment. Your Excellency, thank you so much for taking the time to join us on the podcast today.
Absolutely.
I hope you enjoyed this conversation as much as I did. Remember, please subscribe to the podcast for more of these kind of conversations. But once again, here, live from the Integrated Abu Dhabi Mental Health Conference, Your Excellency Maqsoud Kruse, thank you so much for joining us.
Thank you, millions.